We're going to talk about our recently published paper in the journal JACS, and it's entitled Harnessing Behavioral Economic Principles to Improve Surgeon Accountability for Oral Costs.
And what we did was we determined the effectiveness of providing cost information to our colleagues for individualized supplies of disposables, consumables, and implants in the operating room, understanding that in a value-driven world, understanding the cost of each individual supply as we make decisions about patient care is becoming increasingly important.
Correct. So this was a one-year prospective study across 3 departments: thoracic, endocrine, and urology. 2 cases per department, 1 high spend, 1 high volume, and we deployed a cost feedback tool that was embedded in our Epic EMR system, as well as a monthly email report out. And we laid on top of this behavioral economic principles in design of the study, specifically choice overload, public reporting, immediacy, salience, and choice architecture.
And by doing this, we work with the team of our colleagues in supply chain, in Epic analysis, and in financial reporting. And we created graphs that we provided that were live and available at any click and point in the medical record, but also available by monthly reports. They were graphic. And what they did was identify us in comparison to recognized when our procedures were outliers in comparison to peers.
Correct. So this was not anonymized when it was deployed. And what we showed after a year of the pilot program is we actually saw a 21% reduction in discretionary supply spending in the OR, which is about $900,000. And at the same time, complications or adverse outcomes did not increase in incidence.
And yes, and using that sensitivity analysis, we were able to bring to the attention is that the value of healthcare that we were providing improved as the outcome stayed the same, but the cost went down for these procedures. And through this effect of really having transparency and engaging each other and our colleagues, we have been able to spread the momentum, to expand this throughout the division, and to have more in-depth conversations with our colleagues in anesthesia and interventional radiology in the ICU and elsewhere.
Yeah, so this speaks to a larger culture change of resource stewardship at the institution, which we're happy to be a part of. So in closing, to the surgeon viewers out there, we say the next time you are in a procedure and there's an implant or disposable or a thermal device, you should ask to know the cost of that instrument.
And having said that, Ani, again, as we relate through the entire episode of care, our stewardship for our patients is to know your cost.
Know your cost. Thank you.
Thanks.